Hello, I am Dr. Torres, who has just diagnosed a patient with Marfan syndrome. What is Marfan syndrome? Well, let me tell you about this disease. Marfan syndrome is a genetic disorder that affects the body's connective tissue. Connective tissue holds all the body's cells, organs, and tissue together, and it plays an important role in helping the body grow and develop properly. The connective tissue is made up of proteins, which that specific protein is called fibrin 1. And this disease is caused by a defect or mutation in the gene that tells the body how to make fibrin 1. The type of inheritance pattern Marfan syndrome is autosomal dominant. This is when all individuals inherit 2 copies of each gene, and at least 25% of Marfan syndrome cases result from a new mutation in the FBN1 gene. The genes affected by Marfan syndrome is caused by mutations in the FBN1 gene, and this provides instructions for making a protein called fibrin 1. People often ask how common this disease is. It is very rare. About 1 in 5,000 people have Marfan syndrome, including men, women, all races. Anyone can get this. About 3 out of the 4 people inherit this genetic mutation from a parent who has it. Some people are the first to have it in their family. That is called a spontaneous mutation. While there is 50% chance that a person with this syndrome will pass it along each time they have a child. The biggest question asked is, what are the symptoms? Well, let me tell you. People with Marfan syndrome are born with it, but sometimes the signs are not present right away. Some people have a lot of Marfan features at birth or young, while others have fewer features when they're young and they have more when they're adults. But this syndrome can affect the heart and blood vessels, bones, joints, tall and slender built, disproportional long arms, legs, fingers, crowded teeth, heart murmurs, abnormally curved spine, flat feet. The next question asked is how the genetic disease is diagnosed. Well, there is no single test to diagnose this syndrome. This condition can be very hard to diagnose in children because most of the symptoms don't appear until the child is a teenager or young adult. Some tests include cardiac ultrasound, EKG, MRI, DNA tests to locate and confirm the genetic defect, eye tests. The prognosis of this condition is that in the past, people who have had Marfan syndrome have died very young, but now with improvements and treatments, people with the syndrome now have a life expectancy similar to an average person. Some recommended treatments I have for Marfan syndrome are blood pressure medicines, which help your heart beat slower and with less force, therapy for vision problems, and depending on your sign and symptoms, surgery may be an option. And our last question is that are there any clinical trials, ongoing research, or gene therapy news? Well, each day through research programs, the number of researchers studying Marfan syndrome has grown, and there has been advancing research that improves diagnosis and treatments. So now that I have given you all the background information about Marfan syndrome, let's take a look at my patient. He recently came in complaining with signs of arthritis, but then I found that he has a heart murmur and weak circulation. I also noticed that he is 6'7" and has extremely long fingers. I suspect Marfan syndrome, so I took a look through his family history. I looked at a pedigree of my patient's family with respect to symptoms of Marfan syndrome. Number 1 is my patient. Then 1A is my patient's son, who is 6'7", and he was treated for scoliosis from a very young age. 1B is my patient's daughter, who appears to be normal and average height. 2 and 3 are my patient's brother and sister, who have average heights. But my patient's brother 4 is tall and has had arthritis from age 26. And 5, who is my patient's father, is 6'7", and unfortunately has died. And 6, who is my patient's aunt, has normal limb length, but likes to show off how flexible she is and has lost eyesight at age 40. And 7 is my patient's uncle, who is normal and average height. And lastly, 8 is another uncle with long fingers, has average height, but has circulation issues. And my patient's mother's side of the family all appear to be normal with average heights.